What should you know about buccal fat removal? Imagine sculpting your face to highlight your natural features and create a more defined look. Buccal fat removal is a procedure that can help achieve that by reducing fullness in the cheeks. It involves removing a small pad of fat called the buccal fat pad, which is located inside the cheeks. This fat pad naturally gives the face a rounder appearance, especially in younger individuals. When removed, it can make the cheekbones more prominent and give the face a more tapered, contoured look. Many people seek this procedure to address what they see as chipmunk cheeks or a very full, baby-faced appearance. It can also help improve facial symmetry and balance, especially for those who feel their cheeks are too prominent or heavy. Some patients who are older may choose buccal fat removal to help with sagging fat that contributes to jowls or a heavier lower face, often combining it with other facial procedures like facelifts for a more youthful look. Candidates for buccal fat removal are typically individuals with fuller cheeks who want a more sculpted appearance. It is generally not recommended for people with naturally thin or narrow faces, because removing fat in those cases might lead to a hollow or aged look later in life. Since facial fat naturally decreases as we age, removing buccal fat too early could cause a face to appear overly gaunt over time. The surgery is usually done under local anesthesia, meaning you stay awake but comfortable. The surgeon makes small inside-the-mouth incisions near the upper second molar to access the fat pad without leaving any external scars. The fat is gently teased out and removed, then the incisions are closed with sutures. The whole procedure takes about 30 minutes and involves minimal recovery time. After surgery, most patients go home the same day and are advised to stick to a liquid or soft diet for the first few days to allow the mouth to heal. Swelling and bruising are common but tend to improve within a week. The final results become visible around 2 months after the procedure, with full healing taking several months. Recovery typically lasts about 3 weeks, but patience is key to seeing the complete contouring effects. Like any surgery, buccal fat removal carries some risks. These include infection, bleeding, asymmetry, nerve injury, or dissatisfaction with the outcome. Removing too much fat can sometimes lead to a hollow or aged appearance over time, especially if weight fluctuates after surgery. It's important to have realistic expectations and discuss your goals thoroughly with a qualified plastic surgeon. Since this is a cosmetic procedure, it is usually not covered by insurance, and costs vary depending on the surgeon and location. Buccal fat removal can be performed alone or combined with other facial procedures such as chin implants, neck lifts, or fat grafting to enhance overall facial harmony. It's essential to choose a board-certified plastic surgeon who can assess your facial structure and recommend the best approach for your individual needs. Remember, every face is different, and what works for one person might not be ideal for another. Consulting with a qualified specialist will help you understand the potential benefits and risks, ensuring you make an informed decision. Always prioritize safety and realistic expectations when considering any facial aesthetic procedure.